So, as we continue our series of interviews with some of the thought leaders at LTS, today I am joined by Julia Lodder Gadaczek, who is Director Analytical Development in Vitro Studies at LTS. Julia, good to see you.
Thank you, Paul. Thank you for the invitation. Thank you.
Not at all. Obviously, there will be a few people in our industry that know you and understand what you do. But for those who don't, perhaps you could start by telling us a little about your area of expertise and the role you play at LTS.
So I started to work for the LTS in 2013, and after finishing my PhD, I started as a scientist in the analytical development. And after 2 years, the LTS offered me the opportunity for a laboratory head position in this field, and I started with a very small team of specialists. And today I'm leading a team of 9 people. And in principle, you can say we are responsible for everything which has directly to do with skin here in the LTS. And so we are part of the research field here. And what we do in principle is the in vitro permeation study for nearly every development project in case of TTS and OTF here at the LTS. So we answer typical questions like, has a drug a potential to permeate through the skin? Or how does a new formulation of the TTS or OTF perform in terms of efficacy, for example? And that's what we do here.
At this point, I apologise. I should have called you Dr. Julia Lodder Gadaczek. I can genuinely say I have never met or been in an organisation with so many people with PhDs. I don't think there is anyone at LTS that doesn't have a PhD. I think this is a fascinating subject. I went in. I've been lucky to go into the skin lab and see what you guys do, and for you to be able to mimic in vivo testing and be able to really quickly actually establish the performance of and stability of an API in the skin. That feels like it has lots and lots of benefits for pharma partners. Perhaps you could talk to us a little more about that.
Yeah, so I think the in vitro permeation setups and also the use of these in vitro permeation studies is a very long research discipline here at the LTS. So I think we have experiments more than 20 years. So we started in a very, very early time with these experiments. And in the last years, we optimized our models in such a way that we are really flexible to answer the questions, and we can also adapt our setups to any changing requirements from the formulation side and also from the drug properties, and use this in a very flexible way. And we also established, for example, cell culture experiments where we can answer the questions of an irritation or an corrosion potential, also in a very early stage of development or before we go directly to a new development of a formulation. And I think if you took all these benefits together, we have a really good full service package for our customers in case of what we can do in vitro to design a very good new formulation for a TTS or an OTF. And so this is what we do, yeah.
And I guess the fact that learning then runs all the way through the life cycle right into production is super helpful for clients that it's all under one roof. We've talked a little bit about TTS, about that technology, but of course there's also the MAP technology and oral thin films where you work as well. It feels to me that you have quite a sort of novel way of approaching this research. Could you talk to us a little more about that, perhaps?
Yeah, I think every new formulation and also every new drug is also a new challenge for us, because I think everything gets more and more complex over the last year. And so we also have to adjust our experimental setups in this case. And we have to think about new functions nearly every day. And so what we did for TTS, for example, is that we established a very easy and fast process to investigate drug enhancer combinations and make a ranking of the potential in a new formulation, for example. And we can do this before we go to a new formulation development, and also before we go to the skin directly. So we have here a very good feasibility tool in a very early stage of development. And in case of OTF, for example, we are really not so satisfied in case of fast delivery OTF that we only can work with a static two-dimensional model, because in vivo you have an application in the mouth, and you have the permeation through the whole oral cavity, and you also have a very dynamic process because you have the movement of the tongue and also of the saliva. And so we're working in the moment to adapt this a little bit better and working with a two-dimensional function of our models, and we have a really the change to a three-dimensional model, and that we can have a better in vivo condition application also in our in vitro setups. And the microarray patches are a really new discipline and also a new technique, and that's also a new challenge for us, because we have to think about everything new, because it's not really like a classical TTS, and we cannot handle them like a classical TTS also in our in vitro models. And so we have to change our skin model, we have to change the thickness of the skin, also the receptor compartment, and also the application, because the application of a microarray patch in vivo is nearly not the same what we can do in vitro. And so we have here to work very hard on new approaches also in this field, because we know that we cannot do it like we did it before with our TTS setups.
Perfect. One of the reflections I would make is just the deep level of knowledge and expertise around these technologies that resides not just in R&D actually, but in commercial, in manufacturing. That the whole business really feels like the sort of go-to expert in these areas. Which sort of leads me to my last question, I guess, that there are other organizations that can provide what your service, at least to some extent. If they were considering talking to LTS, what would it be that you would say differentiates you from those other providers?
Okay. I thought about this question, and I think the first thing which came to my mind was passion for what we do. So I think every member in my team loves what he works on. And so this is really something cool, because I have a group of very smart and creative people, and they love what they do, and we are really from different disciplines. And so that's really a good dynamic in our team. And so, we follow everyday new approaches, and we never stop learning on our failures and optimize our models and think about it. And I think also one of the most important cases in our performance is the speed of the delivery of our results, because the development project needs our results for further strategies in the project and also in the development strategies. And so we have to handle the speed of the delivery of our results in parallel to the handling of many projects in parallel, because we work for nearly every development project here at the LTS. And so I decided that I look in other industrial fields and see what they use at project management tools and look what we can do with this. And I found out that we can use tools from the agile discipline, like a Kanban board, for example, because this makes a very high grade of self-organization in my lab, and they know what they have to do. It nearly reduces complexity, because everybody knows what he has to do and has a very good self-controlling mechanism. And so I have really the time to discuss with our development departments and discuss this very in detail, because I have to know what they do, because then I can do what we do. And so everybody can follow my innovative approaches, and so that's a very good combination, I think. And so I'm really grateful that I'm working for a company like the TTS, because like the LTS, because they're measuring my performance on the what and never on the how, and that's pretty cool.
That is pretty cool. And I'd say to I'd suggest that most pharma partners looking for a new supplier, if they see one that has passion, innovation, and agility, I would say they'd be pretty happy with a combination of those things. So, Julia, for now, thank you ever so much. Really good to speak to you, and hopefully we'll catch up soon.
Thank you, Paul.